Well, we've had the privilege as faculty to spend some time with Dr. Garn this morning, and like I said, we have just thoroughly enjoyed our time with him, and we believe you're in for a treat. Dr. Garn has received his PhD in epidemiology from Emory University. He has an MS from laboratory medicine and biomedical science from the University of Utah, and a BS in biology from here. He's currently a postdoctoral researcher at Emory University, working in the Environmental Health Department and in the Center of Global Safe Water, Sanitation, and Hygiene. Let's see, what else? His research has focused on quantifying the impacts of those things, WASH, on infectious disease and educational outcomes. He will present a history of sanitation and health, drawing heavily from his work in the 4 systematic reviews that he's done, which were commissioned by the WHO. So please welcome Dr. Josh Garn, who will be presenting today the impact of sanitation on health, evidence supporting and not supporting strong sanitation guidelines. Dr. Garn.
Thank you. You are in for a treat, but it might just be because I did a bad job. Either way, you're good to go. So I was here 2 weeks ago. In Ben's class. Are any of you, were any of you that one? We have one? Okay. So this was, we'll call that lesson number 1, and this lecture on sanitation, if you wanted to call it number 2, because it's all about sanitation. We got some people. Yeah, it's number 2 lecture. I might have some bad puns throughout the lecture. So today I'm going to be talking about the impact of sanitation on health, evidence supporting and not supporting strong sanitation guidelines. Right now, the WHO is meeting in Geneva, and they're actually going through and developing sanitation guidelines on health. And this last summer in June, I had the opportunity to go to the WHO and present a lot of my research that I've been doing for maybe a year to them, trying to help them develop scientific guidelines that are, based in reality. And so what I want to do today a little bit is imagine them. We in this room are charged with this same exact thing. We're charged to develop the WHO guidelines on sanitation and health. So as I go throughout my lecture, feel free to ask questions. Feel free to point out whatever you want so that we can sort of as a group understand where we're at in terms of how sanitation impacts health. And as you see, it's probably a little more complicated than you originally imagined. I think most of us are in a boat where we strongly believe in sanitation that works, that, that's just what we do, right? But there are some complexities when you actually start studying this stuff, and it sort of becomes messy. And so feel free to ask questions as you see some of these complexities come up today. I'm going to give a history and evidence of impacts of sanitation. It's going to be sort of similar to what I did at the WHO, but it's going to be compacted into a couple minutes instead of a couple hours. And I'm actually going to go to more of ancient history because I think it's pretty interesting, and I actually didn't present on that when I was at the WHO. And then we're going to have a little bit of a discussion on what you think evidence-based guidelines might look like. And at the end, we're going to save a little bit of time for questions, and I'm going to tell you about my research, what I'm going to be doing for the next steps. So this is called the F diagram. Anyone have any guess why it's called the F diagram?
Because it includes like 5 or more than 5 Fs.
Yeah, we got all these F words on the board, right? So we got feces, and between feces and fluids, fingers, flies, fields, we have this primary barrier, and it's sanitation. And what that sanitation barrier does is it stops these feces from being spread into the environment. And I'm mostly going to be talking about this step today, but there are also these secondary barriers of clean water supply and hygiene. And if feces are already in the environment, we sort of have to look to these secondary barriers to improve health. And so this has been around since like the 1950s. It's really famous diagram that sort of describes these transmission pathways and how we can block them. One of the terminologies that I might use some today is improved sanitation or unimproved sanitation. Who's heard of improved sanitation? Okay, perfect. Then we'll get to talk about that. So really, what improved sanitation is we want to separate human excreta from people, right? That's the goal. But it's not always easy to measure that in real life, and so they've come up with some technologies which they call improved sanitation, which help us work towards goals such as the Millennium Development Goals. And in terms of technology, some of these technologies for improved sanitation are flush or pore flush toilets, that go to a pit or a septic tank, but they don't go into the environment. Sometimes you flush a toilet and they just go out into the river water that you might end up drinking later, and that's not improved sanitation, even though it might have a fancy flushing mechanism. Pit latrines, composting toilets, things that are sort of more likely to divide, separate and sequester these species. Okay, and then we have unimproved facilities. Open defecation, obviously, is unimproved. And then we have, like I just said, flush or pore flush toilets that go elsewhere, that go into the environment. Pit latrines without a slab or an open pit, so just a hole in the ground. And that's not really a great measure of health, but that's how they got to measure it somehow. So if there's just a hole in the ground, they call it unimproved. But if there's a cement slab around that hole, they call it improved. Okay. I don't know if it matches up very well with transmission or not, but that's one of the things that we're going to be thinking about today as we sort of think about guidelines. Hanging toilets, buckets, things like that. So there are over 2.4 billion people that actually lack improved sanitation. That's a lot of people within 7 million people. And you can see where the distribution of these people are. They're in sub-Saharan Africa, India, Bangladesh, places like this. And you can see that in green, this is the United States where we're at. We have greater than 90% coverage of improved sanitation. We probably have close to 100, right? We're in a pretty good place. And there are a lot of countries in the world that have less than 50% coverage, and sometimes way less than 50% coverage of these improved sanitation facilities. So we have a lot of work to do. So that's where we're going, and that's why guidelines on sanitation might actually be important, because people tend to listen. The WHO has made guidelines for drinking water, and they're really formative in terms of changing policy for governments and things like that. Okay, so this is the first discovered form of sanitation. Do you see it in the picture over here? Right? Behind this? This is open defecation, right? It's nice and air-conditioned, and you even have anal cleansing materials right next to you. You've got leaves to the dildo. Right? That's sort of the technical term for the way that we clean ourselves after defecation. There are 1 billion people in the world that use this form of sanitation. That's a lot of people. And as we sort of move forward in history, we start to see other technologies develop. This is the first written account of sanitation, and it actually comes from Deuteronomy. I know that's one of those books that you never get to. It's the thick book in the Bible, right? It's part of the Old Testament. Okay, so the cool thing about this, I think, Deuteronomy is one of the first 5 books in the Old Testament, and it's shared with many major religions. What religions is it shared with? Yeah, Judaism, yeah. And Islam, yeah, perfect. So we have over half the world who sort of shares this book. And this was the first, one of the first written accounts of sanitation. And you see, if there be any man among you that is not clean, he needs to go out of the camp, he should wash himself with water. And then we jump down to verse 12. Thou shalt have a place also without the camp, whether thou shalt go forth abroad. We're going to read this and tell me what you think it's talking about. And thou shalt have a paddle upon thy weapon, and it shall be, when thou wilt ease thyself abroad, thou shalt dig therewith, and shalt turn back and cover that which cometh from thee. What are we talking about? This is sanitation, right? This is unimproved sanitation, but this is definitely sanitation. And this is why it's important. For the Lord thy God walketh in the midst of thy camp to deliver thee. And he wants to be in places that are clean, right? And so we've known for a long time across many world religions that this is important. Sometimes it's intuitive. Sometimes we sort of know because we don't like the smell, and so we avoid it, sort of maybe an evolutionary mechanism. But we've known for a long time that the sanitation stuff is important. So, first written account. This is what it looks like in real life, right? We politely call this a cat hole. They call it a lot of different things in my field. I use a very different vocabulary than most of the people in my field. And so this I would call a cat hole. And you see that it's the same exact thing that they were doing, 1400 BC or whatever it was that Moses decided that this was an important law to put into place. And this was one of the newest ways that they dealt with it, but it's a little bit of work to dig a hole every time, right? And so we started to get into technologies that weren't so much work. Here we have these chamber pots, and these existed for a long time as an alternative to open defecation. You go in, you use the pot, you take it outside, and you throw it in the river that you drink out of, right? That's sort of what happened with chamber pots. At least you don't have to have it in your house, but you might throw it in the gutter right outside of your house. I mean, that's what happened with chamber pots. Some of these forms are still used. This right here, my family calls it a rocket box. We're into rafting, and we go down the Salmon River, and what you pack in, you have to pack out, right? And so we have these really fancy bucket latrines that we take with us, and you can mount it in some majestic place and just look over all of this Salmon River while you're sort of doing your business. So we still use these today, okay? But they're not super common. How many of you have used a rocket box in the last month? Ever? We have somebody she's all embarrassed now.
They're really gross.
Yeah, but rocket box user. Okay, and you can see that this has happened for a while. This is the guy coming to pick up the sledgehammer. And then we started to have some sort of more major advances. In Mesopotamia, we have clay sewer pipes, the Minoan civilization. Do you know where that is? Anybody have any idea? It's on an island. It's Crete area. We start to have sewage systems, we start to have pipes, flush toilets. The classic Mayan civilization from 200 to 900 AD, we had underground aqueducts. We actually had water filters back then. It wasn't me. We got Lamanites, right? So this is my favorite one though, ancient Rome. And I'm going to focus on it because it sort of captures still today in a lot of ways. And especially Pompeii. Has anybody here been to Pompeii? 1, 2 teachers only? Oh wow, I'm lucky. I served my mission in Italy, so I've sort of been there and been back. And tell me about Pompeii. Why would Pompeii give us a snapshot of what life was like 2,000 years ago? Yeah.
Tom.
Yeah. Sorry.
No problem. If I remember right, was there a volcano eruption there?
Yeah, Mount Vesuvius.
Right. And they covered, basically preserved a lot of civilization that was there over thousands of years because it was buried.
Yeah, it really preserved everything. It's amazing because you can see what people live like. You can see the good and the bad. I wanted to just show you a picture that I took a while back. See this? It preserved everything. It preserved the conditions that people were in. It preserved, their wash conditions, their sanitation conditions. What do you see? This picture, stands out for there being persons in there that, was actually, I think, rather than smothered in ash, I think what the new hypothesis is based on welling, they were really burned, and then they're smothered in ash, which is really tough and sad. But that's not actually why I'm showing you this picture. Why am I showing you this picture? Do you see any wash in the picture? Yeah, they're all over the place. All of these jugs that were urinated in that people would use to remove their urine. What about on the floor? We got some more of those chamber pots that we were seeing earlier. We got places to wash hands or maybe fetch water. And so in this picture that I took long before I even started studying sanitation, this whole city is filled with a history of water, sanitation, and hygiene. And you can see all the good and the bad. Okay. So we go into the city. We walk in at the very bottom. And we walk up the hill, up this street, all the way to the top. And when you get to the very top, you see this Castellum Aquae, okay? It's basically the water tower of the city, okay? So this is 2,000 years ago that we're going back. And the water flows out of these different places, and it's right at the top of this road right here. And it supplies all of the city. All the little dots that you see in here are actually sanitation facilities in people's houses. Some of them could flush, okay? So we've got sort of this semi-advanced sewerage system where aqueducts are supplying this Castellum Aquae, and this Castellum Aquae is supplying all of the sanitation facilities, all of the bath facilities. And these baths are beautiful. They're giant public baths that are made of granite and marble. And just supplying this whole city in this, what seems to be a really advanced way. Okay, and so this is that street that you're walking up to get up to that Castellum Aquae. What wash stuff do you see in this picture? Can you guys see any pipes, any sanitation facilities, anything? Yes, what's your name?
Lexi.
Lexi, what do you see?
There seems to be like a grate sort of thing.
Yeah, there's a great sort of thing. I actually think this is a little newer.
Okay.
Anything else?
Pretty cool.
That is perfect. That was a perfect answer, and that is a modern one. So that's a good answer. Thank you, Lexi. Yes?
There's a raised sidewalk.
Yeah, there's a raised sidewalk. So we got like a gutter, maybe? What else do you see? Anything? Let's go through some of these things. So what are these? You see that? It's kind of hard to see from here. So we have like these terracotta pipes. This is their sewage system, okay? Where's it going into? Yeah, it's going into the street. And that Castellum Aquae, all the way at the top, and let the water out and just flow all the fecal matter out through the street. It's not really an ideal sanitation system, right? It's not going directly into a gutter. It might go to a gutter, you know, or into a sewer later on. But it's really, what is it? Is it improved or unimproved based on what we talked about? It's not safely managing the feces, right? It's just going out into the open. What else do we see here? Can you see this? Runs right along here. It's a pipe, okay? Guess what the pipe is made out of? Just guess something that's not very healthy. That exists in Flint, Michigan right now. Yeah, we got lead pipes. Lead pipes providing the water. So there's a lot of lead poisoning that happen here. It's not too bad if sort of the water's always flowing, but if the water stops in a lead pipe, then this is what can happen. And like in Michigan, it's not too bad if the water's always flowing. You go out of town for 2 weeks and you come back and you drink some of that water, and you're sort of, especially kids, you can start to have some of the deleterious effects that are associated with lead poisoning. Okay, this is my favorite one right here. See those? What are those?
Stepping stones?
Stepping stones for what?
So you don't have to step in the stuff.
In the stuff.
Yeah, you can go from the sidewalk to sidewalk.
Yeah, so you don't have to step in the stuff. I had sort of an epiphany last night that was meaningful to me. Back 2,000 years ago, people were walking in feces all the time. They even have a mechanism here. This is sort of a more advanced system where they're trying to make it so you don't have to step into stuff, right? And it made it a little. I was sitting here. I was thinking about this last night at 1 or 2 in the morning while I was sort of procrastinating my talk. And I thought of the Savior 45 years earlier washing the feet of the disciples, and it was a little bit more meaningful to think. But this was a guy that would wash feces off people's feet. I thought of the sanitation facilities in some of these places. When you go wash in a river 7 times, and that river in the chapter is known to be the most dirty river in the land, why is it dirty? Well, it's because it's filled with feces, right? And it makes your experience a little bit different because you might have to really exercise your faith to go step into that river. And it might make that service as Christ washes your feet a little bit more meaningful. And it's just a thought that I had yesterday. It was sort of meaningful to me. And I appreciate being here, so I can share that with you. So this is my favorite one. This actually isn't in Pompeii. It's a little bit outside of Rome. What do we got here? You know how girls go to the bathroom a lot together? This is perfect for that, right? You just sit out there, text back and forth, and sort of do your thing. The cool thing about some of these sanitation facilities is you use this sort of open latrine, right? And it drops into a sewage, and then people flush their bath, and you can wash it right out. Okay, so that's the good news, right? So it seems like it's pretty good. Is it improved or unimproved? It's shared, so that automatically makes it unimproved just by the criteria. But what really makes it unimproved, and this is the thing that the Romans didn't get, okay? And this is when we develop our guidelines, jot a note that this is going to be an important thing. The water flows out to the river. And then right after that, the aqueduct is right there, and that's where they get their drinking water from. And so the problem isn't that they're using this advanced sewage system. The problem is that they don't get germ theory well enough to actually understand where they're, what's making them sick. Okay, that their sewerage comes right out, and then their drinking water comes right back. And it's a problem, right? That's not what we want to be drinking if we want to improve health. So we're making advances. The Romans are making advances, but there's a disconnect, right? So what is the purpose? What's the purpose of, why did the Romans do this? Why would you even do, if your sanitation isn't really to improve health, why would you do it as a Roman? Yes. Convenience. Yeah, that's perfect. Do you want to expand on that? Tell me your name. Tell me your name.
Oh, me. Oh,
Yeah.
sorry, Alex.
Alex. Thanks, Alex. Do you want to expound on what you mean by convenience? Just like they don't have to go anywhere to use the bathroom? Or?
Yeah, really, and
Okay.
I mean, they've already got a pipe system there, so why not just put another one?
Yeah, okay. Good. Thank you, Alex. Can you go back?
A lot of what they did was also for image, I think. They didn't want the image and the smell within
Yes,
their
I like your second one, especially smell. Like we can relate with that, even if we don't understand germ theory of disease, like stuff smells really bad. The other reason, I'm not sure you're going to guess it, but it's just flooding. It's a mechanism to get rid of flooding. We have the Tiber River that floods often. We have waste in the street, and it's just a way to clean up the streets a little bit. And so it wasn't a health mechanism. It's sort of a different mechanism, the reason maybe for them doing this. So how did they perform? The life expectancy was really bad around this time. It was extremely poor. You might live 20 or 30 years old. And the thing is most of the mortality happened really early. And so maybe if you made it to 10 or 15, you might live to 40 or 50 or 60. I mean, you're sort of okay then. A lot of babies, a lot of infants, children under 5 were dying. And it's because of these sort of fundamental issues that they didn't quite put together, even though they had these advanced type systems. What other reasons might these sewers not work? I'm just going to tell you a couple, but if you have any comments on this, feel free to join in. Have you heard of herd immunity? Raise your hand if you've heard of herd immunity. Can I get a volunteer to tell me what it is? Chantel. Just kidding. I'm not picking on you. I know you know the answer. Yes.
As we've talked about it, like with vaccines, where because everyone else is vaccinated or isn't sick, then I'm not going to get sick because I can't get it from anyone else around me.
Yeah. So there's a similar concept in the WASH literature that's just starting to come out. It's called herd protection. You don't really become immune, but it's called herd protection. And what it is it matters for me what all of you do, because I live in the same environment as you. I live across the street from BYU, and if you guys openly defecate, it'll affect me. It'll affect my family. And so we can start to study these things in different ways. And what happens is if you're in a system like Rome, where half the people are using chamber pots, and some of the people are using sewage that's actually good, it just doesn't matter that much if 10 or 20 or 30% of the population is openly defecating. It's not going to protect you because you have to reach those upper thresholds, like 90% for a vaccine study. Maybe 90 and maybe 95%. But to get that herd protection with sanitation, you have to reach those other thresholds of coverage and of use. You know, we've talked a little bit about the technologies. We have just sort of this technological disconnect where they didn't safely dispose of the pieces. They sort of did the first step's okay, and then you know, the excreta contaminated water sources, and it caused big problems, huge problems. And what diseases did it lead to back in ancient days? What are some of the famous ones that you've heard of? What's the John Snow one? Yeah, cholera. We have a lot of people dying of diarrhea. Okay. Oh, look, cholera. That's crazy. Okay. So this is actually a notice from back in the day, and we're gonna move from Rome, and we're gonna bump forward in time to what people started doing next. 1800s come around, and we're still in this chamber pot era. We've forgotten about what Romans did. We don't really use sanitation that much anymore. We're sort of back to this chamber pot era, and we believe in the theory of miasma. What does that mean? Do you remember? Yes.
Alex.
Alex.
It's the theory that sickness comes from bad air.
Yeah, check this out right here. This is my favorite part. It gets a hand signal because it's the most important part of the poster. Okay, do not sleep or sit in a draught of air. Whatever a draught of air is, right? They believe that you can get chlamydia from bad air, right? That's way off. And part of it comes because I think people start to associate, oh, this smell and me getting sick, and so maybe they associate these things with bad air. But they had a disconnected theory of disease that led to a lot of the problems that were going on. And the miasma theory really doesn't support safe disposal of feces. It supports getting rid of feces from your immediate environment so you don't have to smell it, but it doesn't support the long downstream impacts that can come from actually safely disposing of the feces. So we have John Snow. What's John Snow famous for? He's the father of epidemiology. And what's the story that most of you know pretty well about John Snow? It's not on here right now. Yeah. Lindsay, right? 1 for 5.
The one with the Broad Street pump.
Yeah, the one with the Broad Street pump. Let me show you that. I think that's in a couple slides. The Broad Street pump, we have a cholera outbreak, right? And tell me a little bit more about that. What do you know? Lindsay.
Basically.
2 for 6.
Basically, he traced the people that were getting sick. Their water supply was coming from the Broad Street pump, so he just cholera back to the
Yep.
contaminated.
Yeah, and there was basically, I think they thought there was a cesspool that had fallen into the drinking water. So they took the handle off and they fixed it. But why was it important? Why was it important for environmental health? Let's go right here, sorry.
It kind of started to disprove the miasma theory that maybe water was a source of like people getting sick instead of just breathing this out bad air. Because if we got rid of that water source and people quit getting sick, but they're still breathing the same air, maybe it would cause it.
Yeah, exactly. It was just a huge contribution to health. If we go back, another thing that John Snow did is he started to notice trends, epidemiologic trends at the time. He noticed that there wasn't any cholera from 1849 to 1853. He started asking questions about why. And he looked at the water sources and noticed that they were, the water sources had moved, so they weren't downstream. They were now upstream, and so clean water should have been provided to all of these people. And so these two things together start building evidence for this germ theory of disease, which is really wonderful. It has a great impact. So we have work from John Snow, Semmelweis. Do you remember him? Nod?
Yeah.
Yeah.
Yeah, he was Austrian and he tried to implement hand washing to prevent death from childbed cancer.
Yep, perfect. So another contributor to this, the wash literature, but also to this germ theory. And then we have Louis Pasteur and really a lot of these people in the mid 1800s were driving this new theory, this germ theory. that changed how people thought about sanitation. And sewers began to be built in London, in Paris, and in the United States and a couple of the big cities. Any of you read Les Mis? Like the full version? The one with the what? We have one over here. It has like 50 pages that talk about the sewer, and that this was sort of the sewerage revolution that was going on, where they're just revamping all of the sewer systems in these major cities, and it had a huge impact on health. Okay, this is two things here. First, I wanted to tell you is our perception generally, I think, in the world is that sanitation really works, and there's a good reason for that perception. The BMJ Readers, which is a big journal that Ben publishes in a lot, I think. I've seen a couple of papers from him the last few weeks. They voted 10 years ago the sanitary revolution as the greatest medical advance since 1840, okay? And we have some big ones. We have vaccines, we have lots of medical advances since 1840, and this was voted as the greatest advance. And part of the reason why is because of what happened during the sanitary revolution. We start implementing sewer systems, and we see mortality rates really drastically rise. And there were other things going on too. We were getting better at other things. But life expectancy, going from the 40s, you would live to the age of 40 to living to the age of 80 is really a phenomenal increase. It's double life expectancy. And way higher than what we're at in Rome, 20 to 30 years old, right? And we start to see these, not just for mortality, but we start to see these improvements in other areas of health. Trachoma. Who knows what trachoma is? Volunteer? On the ground. I just saw a hand in one face. What's trachoma?
It's a series of eye infections that develops into a blinding condition where the inside of your eyelid gets roughed up, and then that scratches your cornea, and your eyelid turns in, and your eyelashes scratch your cornea.
Really good description. Really good. Thank you. Tell me what the vector is for trachoma.
Is it a bacteria or a...
Yeah. It's actually called Chlamydia trachomatis. It's actually
Yeah.
the same genus and species that causes the sexually transmitted disease. And it's spread by flies. So why would sanitation matter for trachoma?
The less sewage around, the less flies, so less bacteria to transmit the disease.
Yeah, you're getting rid of fly breeding sites. Okay, soil transmitted helminths. You know what hookworm is? I think people know what hookworm is. You pass it in your feces. The eggs develop in the soil into larvae. The larvae can crawl up through your skin. Okay. So how does sanitation get rid of hookworm?
You get rid of the feces from the places that you're walking around.
Yeah. Yep. You're getting rid of you're sequestering the eggs, and these larvae can only crawl 4 feet. So if your latrine pit is 5 feet tall, you're good to go. Okay, and so we had these movements, these sanitation movements. I say movements, and it means a different thing when you're giving a sanitation movement. So all of these diseases, trachoma, helminths, height. Let's talk about height. And I'm not going to say too much on height because I can't claim all of the credit for height. Sanitation can't claim all of the credit for height. But why would sanitation impact height? Any guesses?
Just like if you're having malnourished, like from diarrhea or things like that, cholera, then your body's going to be able to grow like it.
Yeah. You have sort of this, insult on your gut, and it causes malabsorption issues. And if you have diarrhea all the time, you have to eating, and you can have stuffing. And height, we can't claim all the credit because nutrition is also advanced tremendously at the same time, right? But people are 4 inches taller now than they used to be. And so, sanitation got rid of trachoma from Europe. It was endemic in Europe. Sanitation got rid of soil transmitted helminths, specifically a hookworm in the South. Did you know that it was in the southern United States? The Rockefeller Sanitation Commission wanted to fix southern laziness, which is just like not having a latrine pit in your house. And so they went in there and they fixed this, southern laziness, or what they called it, and hookworms started to go away. And huge improvements in height during this time. Okay, so now we move on to modern sanitation. I've taken you up through the 1900s, 1920s, 1950s. So the WHO commissioned us to do these systematic reviews on sanitation. Okay, we went into the literature. We looked at all settings. We looked at studies from 1950 to the end of 2015. And we looked at any type of sanitation intervention. It could be a software intervention, it could be a hardware intervention. We had a couple different outcomes, coverage and use. So if we implement a sanitation intervention, does it actually increase the number of latrines in the area, the coverage of latrines in the area? That had never been done before, but it's an important question. Do our sanitation interventions actually work? We looked at exposure. That F diagram that I'm talking about is what I'm talking about when I say exposure. Does sanitation actually decrease the number of flies you're exposed to? Does it decrease exposure on your hands? We looked at health outcomes, the ones that I just talked about: trachoma, soil-transmitted helminths, diarrhea, stunting. And we looked at non-health outcomes, such as well-being and educational outcomes. And then we used meta-analysis to summarize these things. This is our flow diagram. Just to summarize, we had a lot of studies, 12,000 that we started with, and our team whittled it down to the relevant studies. These are our main results for the health outcomes. So I'm just going to orient you really quick. We have all of the health outcomes in the left column. We have the number of studies in the second column, and then we have the impact of sanitation, for example, for diarrhea. And what this means is there are 27 diarrhea studies that we found, and I pooled these using meta-analysis, and we found a mean, this red dotted line for all of these studies. And if that mean is below 1, then sanitation is protective, and if it's above 1, then sanitation is harmful. And so we did this for all of these different outcomes. And if you look at these results in this left column, it looks like sanitation really worked. Most of these are in the preventive direction. This is actually, we use a different metric. We use a different scale instead of an odds ratio here. And so this 0.8, 0.8 is actually, it's still in the preventive. Sanitation is still causing a preventive. There's a preventive association with hyper-HZ score, which is sort of like stunting, but the continuous version of it. But when we start to look at trials only, we see really different results. All of our significant associations go away. Why would that be? Why would trials be worse than observational studies? Just throw that answer out. Any ideas? There are a couple answers.
Difficult to conduct a trial where you have to randomly assign people to.
You have to,
take
yeah.
intervention or not.
I think a big reason is you have to get people to take up the intervention. Okay, yeah, that's a huge reason. And some people argue trials are always better because you get rid of confounding, but in some cases you can't actually get people to take up the interventions, and so it can cause real problems. For our non-health outcomes, we saw a lot of mixed effects. We saw mixed effects on absenteeism and enrollment, and we saw that access to household sanitation was associated with improved cognitive abilities. But for the most part, we just see these mixed effects, like these results that aren't compelling anymore, that aren't what we were seeing in that sanitation revolution that I showed you earlier. And it's for some of these reasons. Most of these studies aren't looking at herd protection. The sanitation interventions vary in quality. This problem of uptake and adherence that was brought up. And so where's the breakdown happening? For sanitation to work, you have to have an intervention. That intervention has to increase coverage of the sanitation facility. And then if everyone has a facility, they'll have to use the facility. And then if they use the facility, you're pretty hopeful that they can actually decrease exposure to pathogens. And then if they do all of those things, you start to see these downstream health and educational and infectious disease impacts. But we're not seeing any effect on exposure. in these systematic reviews. The sanitation interventions as implemented today are not doing a good job. We're also seeing just a really small effect on coverage. So what I mean by that is half of you are randomized to the intervention group, half of you are the control group, and in the intervention group only has a 14% increase in sanitation prevalence compared to the control group. And we want people to get up to 100%. We have just these really small impacts. And so it's hard to implement sanitation the way that they're doing it right now. You know, can we do better than that? Yeah, I think we can. This is a study that we did that we're doing in 10 countries. It's at midline right now. We've got another round of data collection. But we were able to see an increase of, you know, the increase is this green bar. And then we have the yellow is baseline and the blue is end line. And we were able to see an increase, you know, in most of these countries. And the one country where we didn't see an increase, it's Sudan. They have tremendous problems with violence. And so the intervention just sort of fell apart. And as you break these down by outcomes, like diarrhea, what we start to see is that things like sewerage really matter. You know, people who have sort of crappy interventions, crappy latrines given to them, aren't as well off as people who have sewerage interventions. And the comprehensive wash interventions matter. You know, whether they have water, sanitation, and hygiene together matters. You know, I'm coming to the conclusion that going from a bush to a latrine that looks like this may not always make that big of a difference. I would rather go to a bush than a latrine in a populated area that looks like that. It's probably safer. And so we have to balance these things with population density and things like that, and how we're going to deal with this sanitation problem. I just want to show you really quickly what I mean by herd protection. This is a study with 800,000 individuals that we just submitted in 13 countries in sub-Saharan Africa and Oceania. And what we saw in this graph is, this is sanitation coverage from 0 to 100%. We see no effect, no effect, no effect, no effect, until we get to these top coverage deciles. And then when you have 90% or 100% coverage in your community, there's actually a preventive effect. You actually see a reduction in trachoma. And this is for protection. You don't see it until everybody's doing it. And if you took a person from this community who doesn't own a latrine, but all of their neighbors do, that person is protected. So, and that person's marginalized. You have to be really different to be the only person who doesn't have a sanitation facility in your community. You're really different in a bad way usually, and that person's protected. So, as we move forward, I just want to ask you, I want to have a little bit of a discussion. What are things that stood out to you if you were making these sanitation guidelines today, like the WHO, they're finalizing theirs? What would you want in recommendations? What type, and I just want characteristics. For example, herd protection, like you got to have high coverage levels. What kind of things would you look for? What stood out to you? We'll do the awkward silence thing. Yes.
Well, I don't know how to explain it like succinctly, but something that is like culturally acceptable. So even if you have a really good system, if the people aren't going to use it, it's kind of useless.
Yeah, that's
So
actually,
that works.
I have done a lot of work in there. I've done like 8 or 9 of my first author, like all of my first author work that's in press or in published is about how do we get people to actually use the trains better. And that's really important. I think so too. Because that's the problem, right? That's the first step where we're breaking down this sort of transition. Any other thoughts?
I think a big thing too is how you're going to maintain and keep these places clean, like the bathrooms that are made outside. Because I mean, I went on a trip to Africa and I went to a bathroom outside.
Oh, I'm so sorry.
And well, it was like a bomb went off in the bathroom, and so I walked in and I walked right back out. Couldn't do it.
I skipped this slide for time, but I'm going to come back to it. We know, and I've characterized what people want to use. people want to use the same type of sanitation facilities that we want to use. They want to use facilities that are functional, well-maintained, hygiene amenities are available, both for anal cleansing and for menstruation. Certain latrine types are preferred, newer ones. That the latrine has to be accessible, it has to be clean, people like to do things, and you are completely right. In India, it's really problematic. Everybody has a latrine, but it's like storage for trash. Any other thoughts? Lynn?
You don't talk about this, but I know in some countries, like, businesses in gender impact like latrine use, and that there are some countries where men prefer open defecation with women with the latrine, but because of like the power differential, the latrines don't happen. So is that something that?
I think you're so right, and the guidelines actually are going to have a lot on gender. Some of my studies have been on gender, where I go in and do a randomized trial in schools, and you can see that the girls in schools, once they start menstruating and once they start reaching the age where they are big enough to collect water, they start dropping out of schools in the control schools, and in the schools that receive water, sanitation, hygiene facilities, they stay in school. So we need to empower them, and sanitation and water actually does do that. I think that's really important. Any other thoughts? You're doing really good. And we had, these are sort of what the guidelines are looking at. They're targeted to governments, ensuring universal access and use. Let's see, governments and implementing agencies should eliminate open defecation. That's about that coverage. We've got to get the coverage really high. Sanitation systems should meet the needs of the user while addressing the entire vehicle management chain. Sanitation policies and programs should be implemented and coordinated with water and hygiene-related interventions in the context of broader health, education, environmental, and development programs. And that's that last one where gender equality comes into play, number 4. And all of these are expanded with lots of paragraphs saying what this actually means in real life. And I think we got some stuff right. You did good today. I'm just going to take a minute to tell you about some of my future projects. Just so you have an idea of what I do, and then we'll open it up for questions. So I've done some pre-post evaluations trying to figure out how we improve these sanitation coverage levels in different countries. I have a sanitation intervention where we're looking at sanitation and health in Ethiopia, and we're randomizing half of the communities to sanitation arm, half of the non-sanitation arm, and we're looking at health outcomes. We're using a triggering mechanism to help people to choose to build their own latrines. Do you know what that means, like a triggering mechanism? So we do a bunch of exercises where we make people think that latrines are important. Put a pile of poop right here, put food here, and you watch the flies going from one to the other until people are grossed out enough that they say, I don't want open defecation to happen in my community, and I'm going to help my whole community to stop. So it's, smoking through your tracheotomy, that's a trigger. There are these mechanisms that make really strong emotions in us. Can be for good or for bad. I know triggering sort of, we don't do it at college these days, right? But it can be helpful. We have a big grant. The World Bank has invested $140 million to put piped water into communities in Mozambique. And we're looking at diarrhea and stunting already. We've been given a good amount of money to look at these outcomes. And we've asked for a lot more money to look at genetic testing for pathogens and for the gut microbiome. And I think this study, rather than urban water systems and pathogen distribution and gut microbiome in children, because we're dealing with genetic outcomes in diarrhea, I think it should be called something to do with diarrhea because it runs in the genes, right? There's there's different things. But that's sort of a big study. We just submitted a grant. It was a $3.8 million grant, and I think Donald Trump's probably going to, because it's environmental health research. We'll see if it happens. And then I've got other projects that I'm just in the beginning stages of working on. There are lots of interventions that can improve child health. Indoor air pollution interventions, vaccinations, wash, all of these things. And it's sort of a person who does modeling I'm interested in giving stakeholders the tools they need to be able to figure out what actually works and what doesn't. And so we develop models where if you went into this community and it had this background, sanitation level, and you did, this intervention, and this intervention, what would happen? You run a statistical model and you sort of see what happens. And so that's another one. Those are my next steps. Those are things that are in the pipeline. And actually, I wanted to say thanks. It's really been nice being with you today. Thanks for listening. I'm glad that they're giving me the Zoom buzz because that's really motivating. But I appreciate you coming and participating. It's really great. And do you have any questions for me? Thank you.
What's a possible way to implement these systems in countries such as Haiti, where there is a lot of flooding and a lot of their infrastructure is constantly destroyed? A lot of what they do, they dump the feces into the rivers and flood downstream to get away from them, but that moves on to the next village.
But if you have enough money, we have technologies to treat it. That make them safe and manageable. And so that's where health impacts have really been seen recently. We're actually doing a better job of even if there's a flood, we still remove, so that's an option. And using certain technologies over others, that's like how it's planning and just not dumping in the first place. Other things that any other questions? I know you're okay.
Thank you, folks. Please complete your evaluation. This is your ticket to lunch. If you haven't got one, somebody should have one back there. And thank you for coming. Appreciate your time.